Did you know that more than 70% of women never discuss their intimate health with their doctors? Even when they feel pain, discomfort, or have serious problems. Today, I'll reveal a health truth that many women hide, something that can drastically affect their health and quality of life, yet they don't share this problem even with their closest friends due to embarrassment. Welcome to another video where we uncover medical truths that are rarely discussed. I am your guide through the world of medicine, aiming to demystify topics that are often shrouded in shame and taboos. Imagine, your body is a complex system that operates on the use it or lose it principle. This rule doesn't apply only to muscles but also to intimate body parts. Today, we'll talk about what really happens to the female body during longer periods of sexual inactivity, based on the latest medical knowledge and advice from renowned gynecologists. Expert opinion. Gynecologist Dr. Liz Lister, with more than 20 years of experience working with thousands of patients, recently shared her observations about a problem her patients rarely discuss. According to her, this isn't something my patients often mention, probably because they're embarrassed, but it's a big problem. The longer you go without intimate relations, the more uncomfortable they will become. This isn't just a subjective opinion of one doctor. Medical research confirms that longer periods of sexual inactivity can lead to physiological changes in the female body. But why is that so? Let's dig deeper into this topic. Physiological changes. When a woman doesn't engage in intimate relations for an extended period, certain changes occur in the genital area tissue. Dr. Lister explains, this is because the tissue becomes relaxed and blood flow in that area decreases as the body isn't used to preparing for sexual intercourse. To better understand this phenomenon, one needs to know the anatomy of female genitalia. Vaginal tissue is extremely elastic and rich in blood vessels. During sexual arousal, blood is directed to this area, which leads to natural lubrication and elasticity. However, when this process is absent for a longer period, the body somewhat unlearns this function. Imagine an athlete who hasn't trained for a long time. The first training sessions are always the hardest. Dr. Lister uses a similar analogy. It's like exercise, it becomes more pleasant when you develop a habit. Medically speaking, this makes complete sense because our body functions on the principle of adaptation to regular activities. Universality of this problem. It's important to emphasize that this phenomenon isn't limited to a specific age group. Dr. Lister is very clear, this happens to women at any stage of life. Young women who aren't yet sexually active, middle-aged women who are without partners for various reasons, or older women after menopause, all can experience these physiological changes. The difference is that in older women, this process can happen faster due to the natural decrease of estrogen, a hormone that is key to the elasticity of vaginal tissue. Let's also debunk a myth. Many believe that sexual inactivity is more natural for women than for men. Medically, this has no foundation. The female body is evolutionarily shaped for sexual activity just as much as the male body, only the manifestations of inactivity differ. Health benefits of sexual activity. Besides preventing discomfort when resuming intimate relations, regular sexual activity has numerous health benefits. Dr. Lister emphasizes, don't forget that sex and orgasm are associated with stronger immunity and better heart health. Let's look at some scientifically confirmed benefits of regular sexual activity for women. Strengthening immunity through increased levels of immunoglobulin A, antibodies that protect against infections. Improved circulation and cardiovascular system health. Natural pain relief thanks to the release of endorphins. Improved sleep quality through the release of prolactin after orgasm. Regulation of hormonal balance. Reduction of stress and anxiety. Strengthening of pelvic floor muscles, which can prevent problems with incontinence. An impressive list, isn't it? Research shows that sexually active women have fewer problems with urinary infections, menstrual cycles, and hormonal imbalance. Practical advice. If you've been inactive for a longer period, Dr. Lister has clear advice. If it's been some time since your last sexual experience, use lubricants. Lubricants aren't just for older women or those with medical problems, they're a practical aid for any woman who feels discomfort during intimate relations. Choose products that are water-based, without fragrances and additional chemicals that can irritate sensitive tissue. For women who currently don't have partners, Dr. Lister is direct, and if you're solo, find activities and aids. Self-pleasure isn't just a way to maintain sexual health but also to connect with your own body and its needs. Medically speaking, it's a completely healthy practice that helps maintain circulation in the genital area. Contraception, additional advice. Although not directly related to sexual inactivity, Dr. Lister shares valuable advice on contraception that can be useful for sexually active women. The less you mess with your hormones, the better. Many women fear IUDs because they've been used for over 40 years, but today's IUDs are much more effective and modern than previous ones. A survey from 2013 published in the Journal of the American Congress of Obstetricians and Gynecologists revealed a fascinating fact: gynecologists choose IUDs 3 times more often than other forms of birth control for their personal needs or recommendations to patients. There's a reason for that, explains Dr. Lister. Not only are they 99% effective, but they can also control heavy menstruation and menstrual cramps, and release hormones locally, not systemically, like contraceptive pills do. This is important information for women seeking a long-term solution that won't disrupt the body's natural hormonal balance. Of course, the choice of contraception is individual and depends on many factors, including medical history, lifestyle, and future plans. We've reached the end of today's video where we revealed an important medical truth about the female body. Remember, your sexual health is just as important as every other aspect of your general health. Don't let shame or discomfort stand in the way of your well-being. If you recognized yourself in some parts of this video, know that you're not alone and that there are solutions. Talk to your gynecologist openly. Trust me, they've heard much more unusual questions and problems than yours. If you liked this video and think it could help someone you know, share it. It might help a woman realize that what she feels isn't unusual and that there are ways to improve her health. Leave a comment below with your thoughts or questions. I'll be happy to answer all your concerns. What health topic interests you for the next video? Let me know in the comments. And don't forget to subscribe to the channel for more medical truths and advice you might not hear from your doctors. Thank you for watching, and I'll see you in the next video. Take care of your health.